very good evening and thank you for joining us. Welcome to the program this Sunday evening. Tonight we'll be talking about child immunization. I'll quickly introduce my guests so we can get into the conversation. To my very right is Dr. Henry Luze, who is the Deputy Manager Immunization Program with the Ministry of Health. You're welcome to the show.
Thank you, Josephine.
Right, and next to him is Dr. Daniel Tumwine, a pediatrician and immunization advocate with the Children's Clinic Nalia.
Good evening, Josephine.
And then finally, Dr. Sabrina Chitaka. Thank you once again for staying behind after the other show to take us through this again. Dr. Sabrina Chitaka is a pediatrician. Thank you for staying behind.
Thank you, Josephine. Good evening, viewers.
So tonight we'll be talking about child immunization. Let's say it as it is. So we know that there are key immunizations that must be done, the 6 that we used to hear about when we were still in school, right? So I know tuberculosis, diphtheria, whooping cough, tetanus, polio, and measles.
Yes.
What's new? And before we say what's new, how are we doing on immunization of those ones?
Thank you very much. Good evening, viewers. Once again, my name is Dr. Henry Luze, and thank you for hosting me. As far as immunization is concerned, we know that that is the most cost-effective intervention that we can have to control vaccine-preventable diseases, to reduce mortality, which is death, and morbidity, the sickness, or disability that can arise from getting sick. And you are right, yes, the program has expanded over time from the 6 killer diseases we used to talk about. Now we are talking about 12 diseases that the program is offering.
Okay, so before you tell me about the new 6, how are we doing with immunization of these first 6?
Yeah, well, from 2013, we have seen an increase in coverage over the years. And right now, we stand at, as a country, we stand at 95% coverage for the basic antigens that we used as a measure for coverage. Okay. But there's also variation between other antigens, like measles, we are standing at 92%. Human papillomavirus, a little lower than 92%. So we are moving in the right direction, but still we still have a long way to go.
Okay.
Yeah.
So when we talk about these basic 6, these are the 6 that you go to any government hospital and you can get for free.
No, I'm talking about the 12 vaccines.
I'm still looking at the 6 for starters, because those are the ones that ring easily in our heads. So those ones you can get free from any government hospital.
Well, you can get all of the 6 free of charge, yes, you are right. Okay. But also the additional 6.
Yeah. Okay, so tell me about the additional 6 now.
The additional 6, in 2002, the program added what we call Haemophilus influenza vaccine, and also hepatitis B vaccine. It used to be a vial with 3 vaccines, but 2 more added in the same vial to make them 5. So you get 1 shot, but instead of having diphtheria, pertussis, and tetanus, now you have the additional 2 to make it 5 vaccines in 1 vial. Okay. So we added hepatitis B and Haemophilus influenza. Okay. Then in 2013, we introduced the pneumococcal conjugate vaccine. In 2015, also introduced the human papillomavirus vaccine for girls who are adolescent girls, 10 years old. We target 10 years old girls. Then also we introduced the injectable polio vaccine, which is called IPV. And recently, this year, we have introduced the rotavirus vaccine. So all that package of 12 vaccines now, controlling 13 diseases.
Do you have figures that show how now these recent 6 are doing?
Well, the recent 6 I have figures except for the rotavirus vaccine, which we have just introduced recently. But all of them are really matching around the 95%. The good thing is that most of them are given around the same time, so the coverage is almost always nearly the same.
Okay. Yeah. And how do you guys feel about these recent introductions?
Personally, I'm excited. I think that it's an opportunity for Ugandan children to be protected against infectious diseases. And I also think that 12 is not the maximum. In other countries, they actually offer 36 molecules. So we are not yet there, Josephine.
Okay.
Very true. But first of all, I think it's important to know that those 12 killer diseases are actually they're actually one of the most important causes of death in young children. So the fact that the government came out and has provided these for free, and it's not just in government hospitals, by the way, it is also in private hospitals. So even if you walk into a private hospital, you have a right to demand for free hepatitis B. I know there's been a lot of noise about hepatitis B where people are calling to pay and whatever because of whatever, but you know, your child should be getting free hepatitis B. And if your child if your child was immunized after 2002, and they want to, you know, they want to do hepatitis B again, really they are protected at this time. So you really don't need to. So in the private sector, you do have those free vaccines as well. And as Dr. Sabrina has said, there are very many vaccines that need to come up. A lot of doctors are working on vaccines for malaria, for HIV, and all those.
I am going to come to all of those ones that must come up.
There's one that must come up like really quickly, and that's rabies vaccine. We've seen children dying of rabies, yet if they had been vaccinated, maybe they would have been saved, or if the puppies had been vaccinated. Yeah, so there's a lot of issues surrounding vaccinations. But the point Dr. Luze made about vaccines being one of the most important interventions, I think is a key important thing.
In my earlier conversation with Dr. Luze on phone, while I was asking him to come for the show, he said we have a big disease burden that informed the introduction of new vaccines.
True.
So if you said this, and Dr. Sabrina says we need to come up with to introduce the vaccine for rabies, is this a big enough burden that it qualifies? How do we judge which qualifies?
Well, before there's a process we go through as a program or the ministry when you're introducing any new vaccine. We look at a number of aspects. The disease burden is one of them, the cost effectiveness of the vaccine, and whether the country will really manage and sustain, or the delivery system. Do we have enough space in the district to keep these vaccines? And do we have the capacity of the health workers to deliver the vaccine? So we put many things into context. And then we submit. There's an organization which makes an informed decision. Because we have a long list, as Dr. Sabrina mentioned, that we could even go up to 36 molecules. But we cannot bring all of them at the same time. So we have a list, and we put it somewhere where the experts look and say, look, from what we have gathered, the country needs this. This is important, should come at this time.
Yeah, exactly. And I think what people forget is that actually vaccines are quite expensive to manufacture. They're quite complex and they're quite expensive. So for example, in the US, a vaccine might cost, say, for example, $50 or $60. And here it might cost like, 2 cents. And the reason it might, actually 25 cents really, but actually why it might cost that is because we are buying in bulk with other countries as well. So just to be able to introduce, say, one vaccine, so for example, the rotavirus vaccine, I'm sure many mothers recently, or previous mothers in the last few years, used to buy rotavirus vaccines. It was quite expensive, but now the government has brought it in for free. And the processes that do that is a long process, like I was trying to say. There's a whole organization that buys in bulk, negotiates with these manufacturers. So it's a very long process just to introduce one vaccine once the country has identified the need for it.
Are these 12 vaccines that we have now free everywhere? Dr. Daniel, you mentioned that I should be able to go to a private clinic and say any of these 12 I should get for free.
At the right time. Like a 12-year-old won't walk into a private practice and say, I want Haemophilus influenza vaccine. When the government purchases these vaccines, they are given for a specific cohort of children. For instance, the under-1 vaccines are specific for children below 1 year. And then the HPV vaccine, like you had, is for girls aged 10. Those are the ones that the government has purchased.
Okay, just to be clear, because I don't want somebody then writing to us and saying, I went and my child was at the right age and they went to this private clinic and they said it's for paying for, because we've gone to these clinics and you want, for example, rotavirus, and you've maybe gone to the government hospital and it's run out. So you go to a private clinic and the private clinic has it and says 80,000 or 120,000, and the prices differ depending on which clinic you've gone to. So what's happening there?
So I'll say specifically for rotavirus. So rotavirus has just been introduced, as Dr. Henry mentioned, in June, I think. Yeah, I think in June. So I know for a fact that if you now go to private health centers, you are expected to get rotavirus for free. So previously you had rotavirus not being provided for free by the government, so the private sector came in, and then you'd have paid for rotavirus. But during the change, I know there was, and I know this, there was a huge lag. So many people didn't have rotavirus at one point. Maybe Dr. Henry can explain to us. And then you find that there are some health centers which actually had bought and had a previous stock of rotavirus that was for them.
So
but now most of the stock that they have, yes. So for example, at our clinic, right now we no longer bring in private rotavirus. We get stock from the district, which is basically through the Ministry of Health. And so you come to any health center like that, you don't expect, you should not be paying for any rotavirus. Of course, there are other vaccines which the government doesn't provide. For example, MMR and influenza vaccines. Those ones can still be paid for, but until the government comes in and now starts bringing them in, they'll still be available if you're able to afford them.
Okay. Dr. Luze, this whole, because really, if I'm going to have to pay and you're telling me not to pay, I'm going to blame the government for starters, because all things we blame the government, that's how it is. But so how do I tell that I should be able to get this for free even here?
Let me just add on what Dr. has just said. There's public and private partnership. There's that strategy that the government uses together with the public arrangement. Like if you, for instance, Kampala State Council Authority, there are districts, those are their health facilities that have been accredited to work with the authority, Kampala State Council Authority. And those facilities have been trained by us. We have equipped them with cold chain equipment, the fridges. They get free vaccines from the Kampala State Council Authority, and they get the data collection tools, the child register, the child health card, everything for free. So what the private is now expected is to provide the environment, the space, and the health work to provide the vaccine. But we expect that since we have gotten all these free of charge, so the child should get the vaccine for free as well.
So it means that whoever takes the child for immunization, I have to check and see that this vaccine is marked given by the government for free, do not sell or something, because we're not going to see it. You just see it when it's...
Yeah, in the larger, like I mentioned, most of the larger health centers, the private health centers in and around Kampala, have been accredited by the Ministry of Health. So the 12 diseases that he has mentioned, ideally you shouldn't be able to pay for them at, as she said, at the right age. So if I came in and I wanted a hepatitis B vaccine, and I am your age, for example, you'll have to pay for that, because that one is not provided for by the government. Okay. However, if your child is at 6 weeks, is at 10 weeks, and is at 14 weeks, and needs hepatitis B vaccine,
they'll get it.
Yeah, they'll get it. They should get it for free. If they need Haemophilus type B, like he mentioned, if he needs diphtheria, pertussis, tetanus, all those must be given for free. The measles one, not the MMR, because MMR is different from measles, so there's the standalone measles. So
MMR you pay?
Yes. Yeah, because the government doesn't provide MMR, because MMR is a 3-in-1, so they provide the measles at 9 months. So MMR ideally should be given after 1 year. Okay. So if you came and said, I want measles, and your child is around 9 months, you don't need to pay for that.
Okay. Yeah. So there's the scare, and when you mentioned hepatitis, there's a scare about the drugs that were said to be expired. First of all, let's clear that. Were the drugs expired?
No, they were not expired. I know for a fact they were not expired, because I had a conversation with people from the National Drug Authority. The National Drug Authority is responsible for importation of drugs and ensuring the proper regulation. I'm not their spokesperson. However, I do know that the process in which some of the hepatitis B was imported was irregular, and people were making a big, deal out of it and making loads of money. So the government had to regularize the importation of the hepatitis B. But Dr. Henry
I can also add that actually that same hepatitis that was labeled like that was sent to World Health Organization headquarters in Geneva for further testing, and the results came back just 2 weeks ago. They said this vaccine is safe and effective.
Amazing.
So
yeah.
It ends the story that way.
So now the pains, the imaginary pains we got when we thought that we had taken something are gone. But so then my question is, are there some drugs that, because we know there's some drugs that have come maybe before, a long time ago, whatever, that were either expired or what? Is there quality control? How do we ensure that what our children are getting is actually safe for them?
Well, in terms of vaccines, the country procures what we call the WHO pre-qualified vaccine, only the WHO pre-qualified vaccine. We don't purchase any other type of vaccine, and those WHO pre-qualified vaccines are like the gold standard of the best vaccine that you can have anywhere in the world. So we are very confident with the vaccine that come into the country.
Okay.
Yeah.
Well, so we also have a quality assurance program in the ministry. The National Drug Authority goes round. They've been to many private clinics. They've been to different health centers who ensure that the drugs that we actually have.
So they do random checks?
Yeah, they always come in and they always make sure. Even before a drug is imported, they actually go to the manufacturing. They actually have to go to the manufacturers, say in India, in Greece, in Egypt, wherever, and make sure that actually these guys are legitimate, what they are manufacturing is good. So we do have a robust quality assurance mechanism. It's not perfect. Okay, there's still always room for improvement in all these things, but it's actually there as well.
All right. Well, let's take a quick break and we'll be right back.
We offer professional barber, hairdressing at Lugogo Mall, Garden City, Forest Mall, Oasis Mall, and Acacia Mall. Sparkle Salon, professional, affordable, and quality services.
Welcome back. We're coming to you from the Kampala Serena Conference Center Nile Room, and tonight we're talking about child immunization. So when we're talking about some of these immunizations that have to be paid for, and I'm one of those parents who perhaps relies on the government, I cannot afford to fork out 80,000 shillings, 100,000 shillings, 120, and sometimes 140,000 shillings for some of them. What do I do? Does my child now just go like that?
So if the vaccine is out of stock in a particular health center, it will be present in another. And if, for instance, there's stock out for a month or so, the child can actually catch up.
Okay, so now I'm not talking about the 12. I'm talking that are free. Are free. I'm talking about, for example, MMR, right?
Oh, the MMR.
Or any of those. And this parent cannot afford to fork out that money. What do they do?
The idea is that if we manage those 12, your child will probably survive the first 5 years of life.
But also, let's say, take an example of MMR, which is mumps, measles, and rubella. If your child did not get the mumps, measles, and rubella, and then gets mumps, for example, I expect such a parent to go and see a doctor or a pediatrician so that they are managed properly. If a baby gets rubella, which is really a mild disease, they can be managed accordingly. What we worry most about rubella is congenital rubella syndrome. If a woman gets rubella during the time she's pregnant, then her baby could get the congenital rubella syndrome, which is really a baby born with a tiny little head and cardiac lesions, as well as hearing impairment.
Okay.
If your child didn't get, say, BCG, BCG is really the one for TB at birth. And I would also be, say, more worried if you say didn't get the other 3 that you get at 6 weeks than, for example, if you got MMR or chicken pox.
Okay.
Okay. Yes, and while chicken pox, for example, can be debilitating, in most children, if you get it early, chicken pox can be a mild disease. Okay, I got chicken pox when I was young. I never got the chicken pox vaccine, but if I hadn't gotten, say, the one for TB, because the one for TB actually, what it does, it prevents very severe forms of TB. And we have very many people who go around walking, and once your child is born, they come and touch your child and cough in front of your child. And so your child getting TB is can almost be life-threatening. And so having such vaccines is very, very key. I'm not saying that having chickenpox is also not key, but I think if you look at the killer diseases, the real diseases that really affect children,
the government has them covered.
Not has them. It will try to have them. For example, malaria is also a very big killer of children, but we don't yet have the word. We're working back and forth to make sure. But yes, rotavirus, for example, is diarrhea, prevents diarrhea, so we have to make sure that our children don't die of diarrhea.
So these 12, Can I say by age 2 a child has all of them, has taken all of them?
Apart from human papillomavirus vaccine, which is given at 10 years.
Okay. So if I missed, if a parent missed one of them along the way, how do they catch up? Is it possible to catch up, or is it you just missed it, move on? At
school entry, they usually ask the parents for the immunization card, and children are not allowed in school if their vaccine cards are not complete. So such a child would be requested to go and catch up.
Okay. Okay. Do we have to take all of these vaccines?
Yes.
Shouldn't we let the body fight out some of these things?
First of all, legally, I think legally there was a, I don't know if it went through, there was a law that was passed that you must vaccinate your children, because if you don't vaccinate your children and you have your reasons maybe, and your child gets that, you're spreading it to somebody else, and so you're putting other people at risk.
So what's the danger?
So let me just take you back in the early 60s when smallpox was a real problem. And then they discovered a smallpox vaccine and eventually eradicated smallpox in 1979. So indeed, immunization is an intervention that should be a public good. It should benefit the entire population. So if a child, if you expect your body to fight on its own, you may not be that lucky, because we don't know which virus is going to come into which home or which school and infect the entire school. So in order to prevent such a disaster, it's better to prevent before you try to cure.
And why she didn't mention that smallpox actually killed like 300 million people in history. Okay, and now nobody, no one ever has, there's only 2 places in the world which has smallpox, and these are labs, one in Russia and one in the US. And these are just scientists who have them now. But we eradicated that. We're trying to eradicate polio. Okay, when I was growing up, we had very many kids who were not walking properly because polio used to cause a lot of disability. Now we have very rare because of that. Yeah.
Dr. Luze.
Yes.
Can't we let our bodies fight some of these things? Do we have to have all of this immunization? You're very quiet on this.
Yes,
You're from the ministry.
Yes, we need to have all these vaccines for our bodies, not to take any chances. And as Dr. Sabina has mentioned, is that you know, it's not a personal problem. Once you get polio, the risk of spreading to others is also there. So we have to make sure that every child is vaccinated. These are very highly contagious diseases. They can easily move from one person to the next, to the next, to the next. So we don't want to take any chances. And by the way, we are still even introducing more vaccines. The good news is before end of this year, most likely, if not, then early next year, we should also be having rubella MR introduced.
And the reason why we are looking towards introducing MR, the measles and rubella, is so that we can get a second dose of measles. A lot of parents, by the time the baby is 9 months, they forget, they may not actually go back and get their baby vaccinated. So we have pockets of babies who are never vaccinated for measles. And should there be one child with measles, for instance, in a school, then that's an epidemic. And those ones who are not vaccinated will be the first ones to get it.
I was looking at the Uganda Demographic Health Survey 2016, and basic vaccination coverage was highest in Karamoja sub-region, 73%, and lowest in Busoga sub-region at 45%. How come? Why Busoga? And why Karamoja?
Yeah, it's true, really. We've looked at that, and even if you look at the disease outbreak pattern, it strongly suggests that there is more vaccination taking place in the Karamoja region compared to Busoga, where we're having many outbreaks of measles and other diseases. But we looked at the factors why they are not vaccinating. Things that we know, for instance, in the Busoga region, there are emergence of these religious sects that are opposite to many of social services, including health, including education. And also in Karamoja, they have a system of living that aids in delivery of services. They are living in manyatas. Manyatas have a head, and when you go to vaccinate, you really find them in one setting, settlement, and you can easily administer the vaccines. We think that contributes a lot, as opposed to looking to households in diverse environments like in Busoga and here in Buganda region as well. We are not doing so well.
So looking at the Busoga case, I don't know why the reason it is for Central that we're not doing well, But when you speak about things like religion and all of that, and I know there are all these anti-vaccine groups out there that are decampaigning vaccination. Why? Is it the side effects? Like you said, religion. Why else would somebody not want their child immunized?
So some people think that they can do without vaccines and maybe use herbal cures or protection from some higher god. However, the truth is, if a child is not vaccinated, they could actually get the disease. So the anti-vaccine lobbyists are people who are advocates. It's their job. They are making money out of this lobbying and all that. But people need to be educated and told the truth. They need to be told that if a child is not vaccinated, they could potentially die.
I also engage quite a large number. Even my own patients who come in, there are some who will tell you, you know, doctor, I'm not going to vaccinate my children. I think there are very many different levels. Dr. Sabrina has mentioned at that level. He has also mentioned religion. By now we should have eradicated polio if it wasn't for some people in Nigeria, because at one point we had gone down to the last, I think, 1,000 people. You know, we were basically getting rid of polio, but still you have those sentiments. There are also things like, you know, people read around, they say, you know, side effects and of the disease. So the people who are being conspiratorial tend to say, you see, last time I took my child, for example, measles, and the child got autism. You know, that's the common one that is being bandied around. And this really comes from a 1997 paper. Scientists called Andrew Wakefield, 1997, at one point published some paper which said that actually when you get measles, you might also get autism. But this paper was eventually rubbished. It was found to be fraudulent, and he was actually struck off the British Register. Subsequently, a lot of people have also tried to study and see whether indeed measles does cause autism, and actually they have found that it does not. But because of that one thing, a lot of conspiracy theories around that. I get a lot of mothers who says, I've been told it will get, you know, I saw a YouTube thing, or maybe someone told me.
It was a conversation on a particular page on social media.
Yeah, and they're talking about autism. So you're talking about, so you're trying to convince people. I'm like, yeah, because there's a lot of papers, a lot of scientific information that shows that vaccination works. As Dr. Henry said, by the time a vaccine is introduced into our immunization program, there's a lot of processes that have actually gone through. You don't just wake up and say we want to introduce rotavirus. We do a lot of studies. You know, how safe is it? What are the effects and all that? So it's not just, there's a lot of robust science and a lot of robust quality assurance mechanisms that actually make sure that these vaccines are actually safe and efficacious.
Just to say that the government is also not lying down that because there are groups that are opposed to certain services like immunization. That's why we have now the law, which came in place in 2017, that empowers service deliverers to make sure that those opposed to service delivery can really be apprehended. So the government in one place puts the services to the people, and if you don't bring your child for a certain reason, then you are compelled.
These conversations are happening on social media. Maybe a mother will post and say, oh, I took my child for this and this, what happened? So then other people start to advise and say, for example, if you're going to take them for this immunization, first give them Panadol 30 minutes before, or first do this before that. Are these things necessary? Are there precautions that I must take before and after I come back from immunization that the doctors are not telling us?
The fever that a child gets after the immunization is actually part of the immunological process. So if you give paracetamol, you're dampening the immunization process. So it's not advised. I know that mothers on social media particularly are over-sensationalized, and they sensationalize everything, and they are so emotional about it. But I guess people should be cautious. Not everything that's available on the internet, on social media, is the truth. So they would rather ask it from the experts.
Okay.
Yeah, so as she said, a fever is a good thing. Because what happens is that when your body is actually, and she said it, when your body is actually fighting infection, it releases certain chemicals called pyrogens, and these ones actually cause the fever. So if you're going to reduce that fever, you're basically dampening your immune response for that child. And remember, the primary role of immunization is for your body to have an immune response so that they can actually become protected.
Are we giving this information before we actually immunize people, or do we just go and say, immunization, everybody come round, short, the end, go home?
No. The nurses who immunize actually provide this information.
We have a world communication strategy on immunization, which gives information at different levels, including the mothers and caregivers, then the health workers, then the policymakers. So that information is available, and that's actually given. There is a health talk that takes place before the child is vaccinated. Yeah.
Right, let's take another short break, and we'll be right back. Welcome back. We're coming to you from the Serena Conference Center, Nile Room. Well, just before we took a break, we're talking about coverage, immunization coverage, and we know a lot of refugees are coming into the country. We know Uganda, has its doors wide open. How are we ensuring that even the refugees that are coming in are catered for?
Well, thank you. We have a number of refugees. Right now we have over 1.2 million refugees coming in, mainly from South Sudan and the Democratic Republic of Congo. They have settled in 11 districts, including Kampala. Kampala itself has over 100,000 refugees. Wow. So we have measures that screens them at the entry points as much as possible. At the borders as they come in. Those who come through the designated entry points. But quite a number of them come through other channels. We miss them at that point. So what we screen for is vaccination status at that point, but also for any other vaccine-preventable diseases that they may be carrying. If someone has like polio or measles, we need to screen them and isolate them and take them early. So it's not easy to get all of them at entry, but those that are settled in the camps, we are following up with vaccination campaigns. We go into the camps, we just out the children, and actually we do a catch-up. We do all under 5-year-old children. We give them all the childhood antigens so that they can catch up with the rest of the population.
Okay.
And we have been supported by Gavi to make sure that we do this campaign starting actually this month. And for the next 3 months, we should be able to finish all the population. Yeah.
Oh, wow. Yeah. Okay. So we're talking earlier about what happens on social media that, causes mothers to be in a certain place to feel a certain way about certain things. And HPV keeps coming up. Why is there so much attention and backlash on this particular one?
My suspicion is, the adage that says that if a dog bites a man, that's not news. But if a man bites a dog, then, big news. So some people who are vaccine deniers or anti-vaccine lobbyists are all going out of their way to ensure that girls do not get vaccinated. And they are tying it with a lot of myths and wrong conceptions. But the truth is, Josephine, when women are not vaccinated against HPV, then they are likely to get cervical cancer. And every 2 minutes, a woman dies of cervical cancer. And it can be prevented. It can be prevented before the girls become sexually active, because it's a sexually transmitted disease.
So why, again, this is for girls at age 10, they're the ones who get this vaccination. Yes. Why, again, would somebody not want their daughter to get it? Because
there are so many misconstrusions and misconceptions and myths surrounding the vaccine.
So when you engage some of these people, they'll say, oh, those vaccines have been given anti-fertility drugs. Yeah. And of course I always tell people, many of our women are getting pregnant, without wanting to be pregnant. I wish we could know what that anti-fertility drug is so we can actually use it as a family planning tool, But so there's that. And as she said, human papilloma virus, it's a virus that is very, very easily sexually transmittable, and that is why we're giving it at 10 years before we assume that the girls are not yet sexually active. And it prevents, as she mentioned, cervical cancer. Cervical cancer is one of the most commonest cancers not only in Uganda, but in the world. But specifically, you get cervical cancer depending on which part of the earth you stand. Why? Because if you're in Finland, where they have had a HPV vaccine program for the last 20, 30 years, you don't get to see cervical cancer. But in Uganda, where we've not been having this, all our mothers, by the time they hit 50, by the time they hit 60, they are dying because of cervical cancer. And so this opportunity has come to actually immunize against hepatitis, against
cervical cancer.
HPV, which causes cervical cancer.
Dr. Luze, are we doing awareness campaigns on HPV?
Oh yes, we are doing a lot of awareness campaigns from the ministry. We have actually teamed up with the Ministry of Education because most of these girls we are targeting, the 10-year-old girls in schools.
I think that's why I didn't know about these campaigns, because I'm not 10 anymore.
It's easy to reach them at the school, so you cannot go to school when you have not involved the school education sector. So we are working with them. And also for the past 3 years that we have given this vaccine, you know, we monitor adverse events after you have given, at least the immediate ones. We have not seen any immediate side effect with this vaccine. And when you read the social media, they put a lot of things that some of them we could think they come even the short term, it's a bleeding or what, but we have not had.
The stories would really scare a mom who is not well conversant with the issues. You know, they frighten the poor mothers out of. At the clinic where I offer HPV vaccine at Mulago, the vaccine is free. The mothers come in and literally want you to sit down with them and explain, tell them that I vaccinated my own children and nothing happened to them. No one fainted, no one lost an arm or a leg. They are still in school, they are sane, no one has run crazy. You have to explain to them to that detail. But fortunately, mothers are understanding and they are getting more.
And actually we are seeing an improvement in coverage. Right now we are, for the first dose, we are in 85%. The second dose is coming up to over 60%. So we are continuing with this awareness campaign.
Did you say first dose 85%, sixth dose 65%?
65%.
Second dose?
It used to be worse. It was like 23%, but now it's going up.
Right. Well, I liked what you said, Dr. Sabrina, about how mothers usually, you know, take time, but they understand these things. Because the research that was shown by the UDHS says that the vaccination numbers go up when mothers are educated.
Correct.
So I think that will be something that we should actually put into consideration. So while I have you here, I wanted to talk about self-medication. You're pediatricians, the both of you. I don't know if you're a pediatrician.
I'm an epidemiologist.
Public health specialist.
Thank you very much, Dr. Sabrina. So I know that a lot of mothers have a mini pharmacy at home because your child gets sick, you get medicine, you take it home, put it in the closet. The next time they get maybe the same cold they had last time or what you think is the same cold, you just pick out the same medicine you had that's left over and you give it. Is there a danger to this self-medication of children?
A huge one. The first one is giving babies expired medicines. The pediatrician may have prescribed a particular medication when the baby was 6 months, and now the baby is 5 years, and mom still pulls out from her closet that medicine that she bought 5 years ago, throws it down the baby's throat, and that baby could get severe reactions. The other thing is that they may be treating the wrong disease. Not every cough and flu is influenza. Some of it could actually be a more serious bacterial infection. So they could be treating a viral disease with medicine that should be treating a bacterial disease. So misdiagnosis, mistreatment could result in serious problems.
Yeah, so Dr. Sabrina has summarized it very well. I was going to say there are two presumptions that cause that. One, people think that medicines are safe. We learn very quickly that medicine is a poison. Every drug has a side effect. It doesn't matter even if it's paracetamol. Paracetamol can, if given wrongly, can actually cause liver failure, especially if it is overdosed. But we're now seriously seeing a lot of resistance. A lot of drug resistance because you're giving the wrong doses, and so these bacteria actually, if you have bacteria that you're treating, they're actually multiplying with resistant doses. This is the reason why many times when you go to a health center and you have, say for example, malaria, although malaria now has gone down specifically in places like Kampala and Wakiso, you are now given an injection many times. I know they used to give syrups and tablets, but previously we used to have chloroquine. Okay, very fancied, in our times.
Quinine.
Not quinine.
Quinine still works.
Yeah,
it still works. Okay.
But chloroquine, fancied, all those, because everybody used to say every fever is malaria.
What must I have if I'm going to have a first aid box?
I would recommend parents to have a first aid kit in the house. something that can lower the temperature includes tepid sponging or putting the baby in a warm bath that will lower the temperature, removing the clothes, and then having band-aids or plasters that can stop the bleeding, but not to have an entire pharmacy that paracetamol, but which shouldn't be kept for 5 years. It can be kept for a short time and then it's thrown out.
Okay.
Like some families have an entire pharmacy that can supply an entire hospital.
Yeah.
Are there medicines that we are giving children that are not for their age group?
Oh yes, there's a lot of, most of these what we call over-the-counter drugs. So these cough syrups, these flu syrups. I get a lot of patients who come in, doctor, I've given all these Pyritexes and all these different drugs, and it has just failed to help. Now, those particular drugs tend to be very, very dangerous in that age group. And so the side effects can come up. You know, we have a lot of potential side effects that we give our, that come up because of the drugs that we give our children. Specifically, those drugs which are meant to manage your flu and your cough.
Okay.
And so I wouldn't at all recommend that you give these cough syrups that you see and these flu syrups that you see on the market to your child.
Basically, go to a doctor before you give the child any medicine.
There's also, like, if a baby has a viral infection and then they are given non-steroidal anti-inflammatory drugs, the common one is ibuprofen. It could end up injuring the kidneys. And something that you thought was a simple disease may end up requiring a kidney transplant. So
actually, there was a friend of mine who sent me a message, and I think I shared that with you at some point, Dr. Daniel, and she was saying she gave the child painkillers, but I think over time it became a liver problem.
Yeah, so people should be cautious. When the child comes to see a pediatrician, for instance, the pediatrician knows the weight of the baby, the drug should be given at a particular dose. And a parent who is self-medicating is not a doctor. They could go to Google and search, but Google doctors are not doctors.
Let me tell you something.
These are your final thoughts, Dr. Daniel.
Yes, the sign of a good doctor is somebody who is scared to prescribe something because they have to think through the different consequences. If you have somebody who liberally just gives out and doesn't get scared of any of the consequences, because by the time you're giving a child any drug, you as a doctor need to know the side effect, the dosage and everything like that. So it's very important that that by the time you're giving this poison, because every drug is a poison, it has a side effect. But by the time you're giving this drug to your child, there has to be somebody who has told you exactly what the issues are.
Okay. Well, Dr. Luze, your final thoughts on immunization as a whole in this particular conversation?
Well, thank you. I just want to say what I most times say, that we have the vaccines in the country. They are there, the health facilities, government and private facilities, and all the 12 vaccines that we talked about here, they are very safe,
and
they are very effective, and they are free of charge. So we are calling upon parents and caretakers to take the children for vaccination.
Okay.
All child should be fully vaccinated by the time they are 1 year old.
Right. Dr. Sabrina.
I just want to thank you, Josephine, for asking us to discuss this, and let us continue this conversation. Immunization is a real intervention, and it's a public health good. So people should take advantage of it. I really request that girls who have not been vaccinated for HPV go and get vaccinated.
That's at age 10?
At age 10.
Okay. Your final thoughts, Dr. Daniel?
We always forget that vaccines are probably the world's greatest invention. People say it is fire, some people say will, but vaccines are probably the world's greatest invention. They have prevented millions, if not billions, of deaths throughout history, and we shouldn't run away from them. They are very safe. I can bet my own kids on them.
All right, thank you all so much for taking the time to have this conversation. We're talking tonight about child immunization, and that's it from us for tonight. Coming up is NTV Weekend Edition.
Renew your monthly basic bouquet subscription of 18,000 shillings before it expires. Then enjoy 3 free days only on StarTimes. Enjoy digital life.